Today is National Rural Health Day, a day to recognize the challenges and strengths of practicing healthcare in small communities across our state.
KX News' Megan Topping traveled to a rural health center and tells us more about how the Heart of America Medical Center at Rugby is providing care to patients.
Here in rural communities like Rugby, access to healthcare can mean traveling hours for services. But inside this clinic, staff say National Rural Health Day highlights why keeping care local is more important than ever.
Rural healthcare, I think, is kind of on the back burner when you think of all the bigger facilities in the state, but we do provide a lot of that first contact care, that primary care, the care that helps keep people in their homes, the elderly, that, we manage all the little things that come up during the day.
The medical center provides things like a hospital, a living and wellness center, radiology and imaging, and a surgical center, among others. Leaders say they average around 1,000 to 1,400 patients a month.
I think it's nice in small towns that we have a better ratio for our patients, so our nurses aren't inundated with impossible ratios. That helps us attract nurses that want to stay in North Dakota because it is a really good place to work and we have time to spend with our patients.
According to North Dakota Health and Human Services, 46 out of the 53 counties in North Dakota are designated as primary care health professional shortage areas.
Specialty appointments are more difficult to access. We don't have we have some of that here, so we are able to do telehealth appointments with some specialists here, and then we can do some chemo care kind of things, so that eases some burden, but a lot of those like orthopedics or neurology or they have to travel distances to get to see those specialty appointments.
Warsh says resources can be hard to get in smaller areas, but as a staff they work together to make sure patients get the care they need.
The staffing pool is a little more limited than the bigger hospitals have, but our team is really great about helping in multiple areas. Our nurses that work in the ER often work in the swing bed side too. The swing bed side works in the more long-term swing bed, so we float around, help each other as much as we can. This is part of that sense of community that you have in a small town.
In Rugby, for KX News, I'm Megan Topping.
According to Health and Human Services, North Dakota is expected to receive around $100 million per year, totaling $500 million over 5 years from the One Big Beautiful Bill in effort to improve rural health care access, quality, and sustainability.